Hi, good afternoon, everybody. Happy Tuesday. We're just letting people into the room now and people are getting connected. So we will be starting our presentation just in a couple of minutes. This is the community conversation, Hope and Healing During COVID-19. We are happy to be here today to share with you about some great free resources that are available for clinicians and for your clients that can help you with struggles that you and your clients may be having right now as we adjust to the next phase of the pandemic. So we'll just bear with us for just another minute or two while we let some more people connect. Again, thanks for joining us today for our community conversation. We're just letting everybody connect to the meeting and we'll be getting started in another minute or two. Jamie, if it's okay with you, I'm going to share your email address, but not your phone number on the Facebook feed for the meeting. Is that okay?
Sure, that's fine. Thank you.
All right, I'm just going to go drop that on Facebook right now and then we'll get started. All right, so let's get started. Thank you all for being here today. My name is Jeff Feldman. I'm the Director of Advocacy and Communications at the New Jersey chapter of the National Association of Social Workers. And I'm happy that you can all join me today for our presentation, Hope and Healing During COVID-19, with our special guest, Jaime Angelini, who is a Program Director at the Mental Health Association in New Jersey. I just learned today that Jaime is coming up on her 20-year anniversary at Mental Health in New Jersey. So I'm guessing she is a extreme expert in all of the projects and programs that they have going on there. So we're really excited to have Jaime with us today. And just a couple of housekeeping rules before we get started. I will remind you that this webinar is being recorded for future use and that we will be making it available for free to social workers and their clients and general community folks on our YouTube page. Also, I'll remind you that when you signed up for the program, you did sign our waiver, our participation waiver, just acknowledging that this is a public forum and that you will adhere to good decorum, that you will not publish inflammatory or harassing messages in the chat feed or anything like that. And if something like that, God forbid, were to occur, just to remind you that we do have the ability to ask people to leave the webinar if that need be. Otherwise, with that said, I'm very happy to turn the presentation over to Jaime. Oh, and also, if you have questions for Jaime, please put them in the chat box, and Jaime and I will go through those as best we can. And also, please keep yourself on a mute for now, but it looks like we have a pretty small group today, so when we get to the Q&A section, it should be possible for people to unmute and speak with Jaime directly. Anyway, Jamie, take it away.
Thank you. Good afternoon, everyone. And I love that it's a small group, so hopefully we will have some nice informal Q&A at the end. So disclaimer, it is storming here where I am in Atlantic County. So if for any reason you lose me, I will connect to my hotspot and I will come back as quickly as I can. And Jeff will just have to keep talking while you wait for me to reconnect. So I'm Jaime Angelini. I'm the statewide director of disaster services and special projects at the Mental Health Association in New Jersey. And as you just heard, I have been there 20 years. I'm completing my 20th year in October. So it's been a little while that's been my home away from home. So we, if you're not familiar with the Mental Health Association, we have been around for 75 years. We're an agency that provides support, education, and advocacy to individuals and families who have been impacted by mental health challenges and substance use disorders. We have regional offices in Atlantic County, Ocean County, Hudson County. And we have a presence in Union County, and that's where our state office is in Springfield. And then we have affiliates in Passaic, Monmouth, Morris, and Essex. So if we have any affiliates on the call today, shout out to you and thank you for the good work that you all do. And there is a mental health association, in every state in the country. We are a national organization. So today I'm going to talk about our New Jersey Hope and Healing Project, one of many programs that we operate, but being that we are still in the midst of COVID-19 and this pandemic, I really wanted to make sure that I share with you this free resource for yourselves, your colleagues, your families, and then those that you serve in the community. So if you have not seen the program before, you're not familiar with it, New Jersey Hope and Healing is a FEMA SAMHSA program. It's through a FEMA SAMHSA grant, but it's in collaboration with the New Jersey Department of Human Services, Division of Mental Health and Addiction Services, Disaster and Terrorism Branch. So together we offer this, what we call CCP, Crisis Counseling Program. The Mental Health Association is one of several providers in the state. So there are 12 of us, so 11 other wonderful agencies providing New Jersey Hope and Healing crisis counseling. But I'll talk about the work that we're doing today so that you're familiar with it. So you might see a slide like this somewhere in your travels. You may see a brochure. You might hear a radio spot if you're in the supermarket or see a beautiful poster that really just says this. Are you struggling? Are you experiencing stress and anxiety due to COVID-19? New Jersey Hope and Healing is here to help. So we have this information out for people in the community. We have a call line and a text line and virtual support groups, and I'll talk about those in just a moment. But wanting you to kind of know, where we are based and that this really is this wonderful collaboration with Department of Human Services. So a little bit about the program, because sometimes we hear crisis counseling and we tend to think clinical or more traditional counseling. This is very different. The mission is to assist individuals and communities recovering from the effects of a disaster. And we do that through community-based outreach. We do it through psychoeducation services. You may remember New Jersey Hope and Healing from after Superstorm Sandy. We had the same program. It was delivered very different then. We were able to go door to door in impacted areas. I remember having tables set up at the supermarket and in community centers because it really is non-traditional, and that's how we deliver the service. It's short-term interventions. We focus on goals, and again, just assisting that who we call survivor who's gone through a disaster. The disasters that we are typically more familiar with are natural disasters, like a hurricane, a flood, a fire. In this case, we're referring to COVID-19 as that disaster. So the work that we do, our crisis counselors, is really working with individuals to understand their current situation, mitigate their stress, develop coping strategies, or promote the coping strategies they already have. I don't know about you, but for me, when I'm stressed, I forget a lot of my coping strategies. So sometimes just having that support and being able to say, what have you done before when things have been really difficult, and encouraging someone, that's a big piece of this recovery process for people. So it is different from traditional treatment, and many of you on the call are probably, clinicians and providing more of that traditional treatment, which we need, and we do make those referrals. But when you look at this slide here, I want you to really focus on the crisis counseling part. It is home and community based. So like I said, if we were not in the midst of the pandemic and it was completely safe to be in the community, you would see us anywhere and everywhere. It is really focusing on assessing strengths and coping skills. We are focusing on the disaster. We are not diving deep into someone's past trauma. We really are focusing on, validating those common reactions, those shared experiences of this disaster of COVID-19. The focus is very psychoeducational, and we don't collect any identifying information. So if you are making a referral, or you're saying to someone, hey, check out one of the groups, or give a call to the call line, maybe letting someone know that we're not keeping any records or charts. We're really just focusing on that community-based service. So definitely different from traditional treatment that we might be used to in the mental health field. So here's a little bit about the model. And again, all of our social workers on the call are used to models like this. It's strengths-based. So we are always going back to what's working for that survivor, what has worked in the past. Like I said, it's anonymous, completely outreach-oriented, culturally aware and informed. We have such a wonderful, diverse group of crisis counselors, not just at the Mental Health Association, but around the state. And again, conducted in non-traditional settings, designed to strengthen existing community supports. I'll show you a slide shortly where it kind of shows us in the middle and all of these other community supports around us. We do not want to recreate what's out there. We want to tap into all of the other resources, and that's really the basis for the CCP. And then again, based on that assumption of natural resilience and competence that we all have, we are always focusing on building resiliency, educating the community. So it may not just be that survivor, it may be a group or an organization. Like today, I'm doing public education. That is a piece of what we do in our CCP. But we also are reaching out to municipalities and police officers and mayors and anyone that comes in contact with their community who may be struggling or maybe experiencing the emotional impacts of COVID-19. We want them to know about the program also. And again, helping people access other services. So although this is certainly not case management, we can let people know what else is out there. We can help them get linked and connect the dots if they need something more than what we can provide. That last dot point talks about leaving a legacy. And we did that after Superstorm Sandy, and I think we will do that again. There will be support groups that continue long after us that are not facilitated by a crisis counselor, but more, facilitated by peers who came together. We had one after Sandy that stayed together for probably several years after, a group that continued to come together. And that's a piece of what we want to do. We're always thinking about legacy because this is a grant funded program. It is short term. So we're always thinking about, well, what can we leave the community with? How can we leave the community stronger? How can we be sure that there are resources intact and in place for survivors who might need them when our program is no longer there? So there is a range of crisis counseling. So when we talk about CCP or crisis counseling, individual crisis counseling, so that's definitely more peer focused, again, not clinical, but we can speak with someone in person safely or over the phone, again, focusing on how do we problem solve the current reactions of this disaster. How can we work with you to build resiliency? Group counseling has been something that has been extremely popular. We are doing about 30 different we call them group encounters every single week. Some weeks we hit 300 participants that come through the groups or the presentations like this. Assessment, referral, and resource linkage. So like I said, we definitely are linking people to other resources that they might need. So for those in the room today, that may be that resource for someone else, definitely let me know, because as we're meeting people who might need a higher level of care or another type of referral, we definitely want to do that. We want to make sure that we connect people really well. Community support and networking is a huge part of New Jersey Hope and Healing. We're happy now that we're back in the community somewhat. So last week weekend we're at a health fair. We love doing that. We want to get the word out. We want to build community and build partnerships. So for all of you today in this room, I'm building that partnership. Hopefully we'll follow up after, and I'll make sure you all have my email. That's a piece of this. And then the public education. So that can be a forum like we're in today. Also, you can invite me into one of your staff meetings in your organization, or if you're part of another community group and you feel like it would be helpful for them to learn more about New Jersey Hope and Healing. That is also a very big piece of the work that we do. Really happy to do public education. What we noticed after any disaster, and I'm sure you're seeing this too, is that people are more likely, more willing to talk about mental health. to talk about emotional health after a disaster, because everyone's talking about it. So as a mental health advocate, that's good news for me. That's good news when people are more likely to open up and discuss mental health. So we want to make sure that we're doing that through public education, that we're getting the word out that what many of us are feeling is okay. It's typical. It's normal, even though I hate to use the word normal. We've been through something really difficult. So the more we can talk about, hey, we might need to reach out for additional support, and that's okay. We want to share that message, and that is definitely a piece of what we do in New Jersey Hope and Healing. So here's that slide I talked to you about. So crisis counselors, we're kind of in the middle there, and then look at all the other partners. So we have been partnering with schools. We're doing a lot of work in the schools, not only with the students, but with the educators. For anyone in the room today who is an educator, my hat off to you. Thank you. I have 2 teens who've been home virtually learning. We know this has been very difficult for educators and school staff. So we're partnering with the schools, providing self-care and wellness workshops for the school staff, but then also for the students as needed. And then, of course, like our traditional substance use and abuse agencies, mental health agencies. We work really closely with our VOADs, volunteer organizations active in disaster. The nice thing about the VOADs, if you're not connected, I recommend you get connected, because we work together to plan and be ready for disasters before the disaster comes. And that way you kind of have those partners in place, which is really great. And then, of course, consumer advocacy groups, our first responders and frontline workers. We've done a lot of outreach and a lot of support for them, obviously. Our faith-based organizations, that has been a wonderful partner for us. And then, like I mentioned before, elected officials, letting those individuals know about the program so they can let people in their community know, our healthcare providers, and then other partners. So that really is, what we do in crisis counseling, is kind of reaching out to all the existing partners and continuing to develop partnerships so that long after this disaster, we will have those partners in case they're needed again. So at the Mental Health Association, when we talk about our CCP program, we're referring to a few components. One is our statewide telephone and text line, and I'll talk about those separately in a moment. And they're offered in English and Spanish. Our telephone line is offered in multi languages, and our text line is English and Spanish. And then our virtual support groups, which are offered, I'd say, every single day of the week, we have something going on. And then those self-care workshops and public education presentations, which are available to anyone, all of you in this room, and any organization or group who feels like they would just like some added support for their team, their group, their staff, what have you. And this is just a little picture of some of our flyers. I'm going to show you a whole bunch of them in just a moment. So our call line, if you're not familiar with it, 866-202-HELP. I will make sure that you have that number before you leave. I can put it in the chat, and also make sure that if you want, you can take a picture of this slide. Our call center operates 7 days a week, 8 to 8. Our call specialists have been, I would really say, like those community primary gatekeepers in New Jersey for crisis counseling. It is sometimes the first stop when people are calling for emotional support, for resources, for linkage and referral, to learn about any information that's available out there. So every single day we have our call specialists on those lines. They are a group of wonderful people. I can't say enough about them. You'll notice some great advertising here. We have someone that donated a billboard down in Seaside Heights, so people that are walking the boardwalk can look up and see that there's free emotional support, and the phone numbers on there. So our call lines have been operating, just in terms of numbers, to give you an idea. Prior to COVID-19, we were probably getting about 350 calls a week. And now, since March of 2020 to even the present, sometimes our call line, we get about 800 calls a week. So people are still calling, people are still in need, and our specialists are doing an amazing job. So that's one piece of our CCP, is our call line. And then our tech support, which was new for us. So we launched this during, our CCP project, probably about a year ago is when we launched the text line. And what I love about it is that there's kind of 3 components. So there is live crisis counseling 2-way. So you can, pick up your phone, and Once you enroll, you can go back and forth with a crisis counselor. You can receive emotional support. You can ask about resources and referrals right from the comfort of your house, from your phone. Our frontline workers and healthcare workers, for some, they said early on, it was really helpful to just be able to text. They didn't have the time to pick up the phone and call in between shifts, and the text really helped them. That dot in the middle talks about our personal concierge, which really offers participants personal messages up to 3 times a week. So once you enroll, you'll receive messages. They range from emotional support, tips on staying healthy, different facts and information as things came down through the CDC. I would get those on my phone and they were great. And then they initiated keywords. So this is a list when you enroll of about 6 keywords. I have them here in front of me. And you can, throughout the day, throughout the week, text one of those keywords. So for example, if you text the word song, you would be provided, a motivational song. If you text the word mood, you would receive something uplifting in your message. So again, something really nice and different that once you enroll, you can stay, a part of it for as long as you want to. You can opt out again, if you choose to. But sometimes for many of us, just that little bit of motivation every day, I know for me, it's really helpful. So for this, and I'll share it again, you would text the word NJ Hope to 51684, and I'll make sure that's in the chat at the end. So texting NJ Hope to 51684, you do a short little form and enroll, and then you can take part in any of those services. So that's another piece of our CCP is our text support. Some of the expanded populations that we've served, especially with our group counseling, which I'll talk about in just a moment, are individuals living with any access and functional needs, our college students. We've had an ongoing group for college students, essential workers, frontline workers, first responders, and healthcare workers, school nurses, older adults, our LGBTQ+ community, parents, pregnant women, Spanish-speaking individuals, our school staff, veterans. The list goes on and on, but I didn't want to put too many slides on here, but I wanted to give you an idea of the expanded populations who we are serving. At the Mental Health Association, traditionally, like many of you, we were working with individuals who were experiencing mental health challenges or substance use disorders. The CCP has allowed us to really expand our reach to anyone and everyone who's been impacted emotionally by COVID-19, which, let's be honest, is really all of us. We've all been impacted in some way. I mentioned this before, so many partnerships, connecting with the community, connecting with township libraries has been something that's been really resourceful for us as a CCP. We do monthly provider forums. We have a diverse team I mentioned. I'm not going to go through everything on this slide, but I wanted to just remind myself as I was talking today to really talk about the expanded activities and so many people we've been able to work with in the community. All the new relationships, all the stakeholders, which have been available through our New Jersey Hope and Healing program. So every month we have a calendar like this. And again, if you're interested, you can send me your email. You can email me and I can put you on our mailing list. Every week we do an e-blast. And we do a calendar like this in a PDF. So for individuals, it's really easy to just click on the link and enter the group. We also do it in a JPEG, so you can share it on social media. That's a little picture of some of the people on our team who you meet. And we're doing all of our group counseling, group support on Zoom right now. It's really worked well. We didn't know in the beginning, probably like many of you, how it would work. But we find that people feel comfortable joining from the comfort of their home. Of course, they don't have to put their video on. They can name themselves anything they want. And we also have people say, hey, I don't have the barrier of childcare or transportation, or even the social anxiety of walking into a support group. So we've been able to really tap into folks who, for this, the virtual support works really well. So this is our calendar. And then I'm going to show you some of our really beautiful flyers in just a moment. We also do a monthly forum that is open to all of you. And we really try to invite our partners and stakeholders in the community to learn more about New Jersey Hope and Healing, to learn more about the Mental Health Association. So on the 4th Thursday of every month, we have different speakers. We do an interview style. And that's, again, one piece of our CCP that makes it a little different, is that we're hoping to have this forum long after New Jersey Hope and Healing, as a way, just like you are today, to bring people together. So here are some of the groups. And again, these groups are open to anyone. So please, feel free to share this information with those who you serve. And then of course, yourselves, your family, your friends, and your colleagues. So we have a parents group, which, I said that I am a parent. So this group is one that I absolutely love, really helping parents come together to just talk about what they've been through. And these groups have been running, probably since I'd say April or May of 2020. We have a new group called Now What, which I'm sure many of us can relate to, really talking about this next phase. And I like that Jeffrey said next phase. He didn't say new normal. So I love that he mentioned that in the beginning, but really thinking about what is this next phase and how do we manage it emotionally? And how do we stay well as we move into that next phase? I mentioned that we have our college student group. We know this has been a difficult time for college students. So we meet every week on Zoom, and we have younger college students who are incoming, who are attending the group. And then we have those who are maybe, outgoing senior year. Again, just a time to come together, share some peer support. We have our group for our LGBTQ+ drop-in, and that's every Friday at 4 o'clock. And then here's a few more. So we have a group for those who have experienced COVID themselves, tested positive, or are recovering, or even family members come to this group to talk about what that's been like. We have a grief and loss group, and it doesn't just have to be someone who has lost someone to COVID-19. We have people who come who just talk about the loss because of COVID-19, the grief and loss of so many of our, areas of normalcy and our rituals, and just so much that we have experienced this year. People come and they bring that to the table and they share it with others and they support each other. And then we try to do some things that are a little outside the box. So we have food and mood. And this is every Tuesday night. This is a group that, again, I really enjoy. And it really talks about healthy eating, maybe the way we've changed our eating during COVID. And again, brings people together to just have that hour to mitigate stress. And that's what this program is all about. When we talk about New Jersey Hope and Healing, we're thinking about how do we mitigate our stress? How do we build resiliency? On Fridays, we have our mindfulness. It's at noon. So a lot of people will drop in on their lunch break, which is really nice. Those who are working are able to sneak away for a little bit. We'll drop in on Friday afternoons. Our school nurse group has been extremely important. We have a wonderful school nurse on our team who is one of our crisis counselors, and she has just led the charge in helping to support school nurses in New Jersey. And that has been an extremely popular group. And, our school nurses are working so hard, and we're so glad they're coming together and supporting each other. I mentioned we have groups in Spanish. You'll notice here we have 3 groups that meet every week. They're very well attended. And our facilitator leads the entire group, in Spanish. And again, those have been, very well received and very needed in our diverse state of New Jersey. I just added this in because you might see some of our stuff when you're out there. We have some of these in the vaccine sites, these posters here that kind of come up on the rollers, so that if people are in the vaccine site and they want to call, they can. We've had these in the testing sites. We've stopped by at some of the vaccine sites to drop off brochures. You'll see our stuff on, some of the buses in the community, in the supermarkets, lots of brochures out there, because again, a piece of CCP is getting the word out to the community. So I figured I would just share that slide with you also. And I'm going to stop there on slides and open it up to Q&A. I hope you have a good idea of what New Jersey Hope and Healing is, what we provide. All of the services are free and open to anyone and everyone in New Jersey. So I have my contact info there, and I'll kind of pause there for just a moment.
Jamie, thank you so much for that wonderful presentation. Really, really informative, great information, and really well presented. So thank you. I'm going to ask if you could just stop sharing your screen so we can see everybody on the call. And for those of you who are with us on the call, if you would like to speak, you can go ahead and raise your hand on the Zoom screen, and we'll call on you and you can unmute and speak. If you do not want to be heard, feel free to type your question in the chat box or to send me a private chat. I'm Jeffrey Feldman, it says in here, if you want to send me something privately, and we'll present the questions to Jamie. I see a hand already. It looks like it's Jean. Go ahead and unmute yourself, Jean.
Thank you. Hi, everyone. Quick question about when we refer individuals to the hotline for emotional support. Is there a time limit when a crisis counselor is working with the individual on the phone?
So I think initially, they're probably going to spend a little bit of time working with that individual on the phone to see what their needs are. And if they do need follow-up, they can receive a call back from a crisis counselor who can provide up to 3 or 4 sessions over the phone. So initially when they call, I think they would do a little triage. And then if that person they felt like could benefit from some additional crisis counseling, and again, not clinical or traditional, but we're happy to then follow up and offer that person several phone calls to focus on stress management. We can set it up that way.
So just a quick follow-up with that, can you give me a rough estimate, like 15, 20 minutes per person?
Yeah, probably about that. I would say our call takers probably spend about that time initially on the phone. And then from there, help someone move to what they need next, whether it is additional crisis counseling, or maybe something more therapeutic or just a support group.
Okay, thank you.
Sure, thank you.
I have another question. It may be a bit repetitive, but just so everybody has the information and knows how to connect. So for people to get connected with the Hope and Healing program or with the crisis counseling program in general, what's the best way to do that? Is there a listserv they subscribe to? Should they send a text to the 51684 number to get connected? Like, how do people stay in the loop on this and just start?
I think calling our call center would be a great way to get connected and then to learn more about the support groups or get connected to me that way. If people are interested in enrolling in tech support, which I recommend everybody do that, I think it's a great service. They can do it that way, or they can just show up at a support group. And then from there say, hey, I would like to find out more about what you do. I'd like to be on your email list. So we've made it so that there's a few different avenues that people can find their way to us. And you can always lead them back to me and my email address. I'm totally fine with that.
Great. And the programs and schedules for all the programs that you mentioned today, are those available on your website?
Yep. So MHANJ.org is our website. And then you can just click on New Jersey Hope and Healing once you get to our main page, and everything is listed there. It's always updated. If there's any changes, it's updated. And again, for anyone that subscribes to our listserv, you'll get a weekly e-blast with anything going on with New Jersey Hope and Healing that then you can forward out to anyone you want to.
Fantastic. I have another question. Christina would like to know what some of the statistics were like pre-COVID and post-COVID for use of the crisis hotline, and maybe what kind of specific problems or challenges have people been experiencing during COVID? Like, what are some of the frequent things that people are reaching out for?
Thanks, Christina. So I'll start backwards. What we're seeing now, I think, is a lot of re-entry stress. And it's not just about returning to the workplace, it's about returning to the world, this next phase, as you mentioned. So a lot of our conversations in group have been around re-entry stress. Also, a lot of conversations around vaccine stress, and that has shifted. So if you would have asked me in December or January, I would have said people are worried about getting an appointment for a vaccine. Now people are talking about the stress of families feeling divided or workplaces feeling divided around the topic of vaccine. So that comes up a lot. And again, we don't weigh in around vaccine. We just focus on how do we help you reduce your stress and worry and anxiety around the topic. We're also hearing from a lot of parents because there's still so much uncertainty. We believe and we feel and we hope school will go back to normal in September, but we're not sure. So we have parents who are feeling extremely stressed and are also readjusting their lives and their work schedules that have been turned upside down. So those are a few of the topics that I think we're seeing probably primarily in our groups. And then in terms of numbers, we've definitely seen an increase in need. So, I'd say at least, by more than half. So if we were seeing about 350-ish people calling our call line prior to March of 2020, And now some weeks we're seeing 700 or 800 people calling in. I think in terms of numbers, that gives you an idea of the need in New Jersey. And really people are calling in for so many different things. You know, for some it is just, you know, like Jean said, calling and having that 15 or 20 minutes of emotional support. For someone else, it might be that they're looking for a very specific resource or referral, you know, to a program. But yeah, I would say the need has increased, and I don't see the need increasing as a bad thing. I'm glad people are reaching out and asking for help and asking for support. So happy that people are taking advantage of this free support service.
One of the things that that this conversation has kind of brought up, and I'm glad that we're discussing your program kind of on a more macro level right now in this webinar, because it's comforting in a way to hear what some of the other people are struggling with, because I think so many of us feel alone right now, and it feels like we're the only person experiencing what's going on. We've never been in a situation like this, so there's no baseline, there's no common sense answer. And so, you know, somebody might be struggling with vaccine hesitancy, and maybe one parent is opposed to the vaccine and the other isn't, but we're all just kind of feeling like we're the only person going through this right now. And I think one of the great things about this forum and about your program in general is that we're really so connected. And it's easy to forget that when you're dealing with a struggle like this.
Yeah, absolutely. And I'm glad you mentioned that. That feeling, I'll just speak personally, that feeling of being validated, that I'm not the only one going through this. That I'm not the only one whose life has been turned upside down. And just when you feel like you're readjusting, it's time to readjust again. So having that peer support has been really helpful for a lot of our group participants and those who are taking advantage of our services to know, like, hey, I'm not in this alone. There's others going through it, and I have someone who can support me. And you're right, this is new to all of us. You know, our last great pandemic was 1918, 1919. They didn't leave us a playbook. I think we now, all of us, including those in this room, we're writing the playbook, the lessons learned, because we didn't know what the mental health and emotional health impacts were after that. I think we're gonna, you know, together do a nice job of writing those lessons learned as we move out of this. Agreed. Yeah.
I'm also glad that you mentioned specifically reentry stress and people experiencing that right now, because I think while there are people who are already struggling with social anxiety disorder who are probably going to have a very difficult time leaving their homes and re-engaging with the world, there's probably a whole slew of people, I would guess, who have not really experienced social anxiety before, that are now having trouble leaving the home, returning to office, going out in public and shopping and doing things. So yeah, I mean, the fact that reentry stress has come up and that organizations and therapists are talking about it, I think is really important.
Yeah, absolutely. And we go back to uncertainty. Uncertainty is what drives our fear and anxiety. And anytime we're feeling a piece of uncertainty or something might change again, and just kind of that playing in the back of your head, like, will it change again? What will it look like in the fall? These are the conversations that come up. It definitely drives a piece of that anxiety. So we're working really hard to help mitigate that in the work that we're doing, especially around the reentry stress.
Thanks, Jane. Other questions? Again, you can raise your hand on the Zoom screen or use the little the hand icon in Zoom. Or I guess since we're such a small group, feel free to just unmute yourself and speak, as long as you're not speaking over anybody else. I have another question from Carrie. I was curious about the VOAD, the Volunteer Organization Active in Disaster Partnerships. She's wondering how clinicians and organizations can get involved with those planning sessions and become part of that network.
Yeah, so the VOAD is wonderful. And actually this Thursday on our monthly forum, we'll have Keith Adams, who's the executive director of the New Jersey Forum, New Jersey VOAD. So if you are available Thursday at 10 a.m., we keep it really tight. We stop at about 10:45, but we'll be interviewing him to learn more about the VOAD. I also could send out some information. I've been a member of the New Jersey VOAD for a long time, and it is a wonderful place for organizations to be part of disaster planning And, again, long before there's a disaster, to have those partnerships in place. And you also can just look up, NJ VOAD and learn more about it, or reach out to me. And if you can, please join us this Thursday morning at 10 a.m.
Yeah. Do you want to drop your email in the chat box again, just so it's
Yeah.
current towards?
Absolutely. Yeah. Thank you.
Yeah. And while you're doing that, I'll just, Ellen just has commented, thanking you for the acknowledgement of grief and loss in this process too, and that it's a great addition to your offerings.
Thank you.
Questions for Jaime about any of the crisis counseling programs or the Hope and Healing program specifically? I guess I had a follow-up question and a little bit of follow-up information when we were speaking to linkages to services. So as you had mentioned, when people call the hotline, when people reach out, there is the possibility for the person they're speaking with to link them to services. I also wanted to point out that at the beginning of the pandemic, Mental Health Association of New Jersey and NASW New Jersey entered a partnership for referring services. So there is actually a page on the NASW New Jersey website. It's right on our homepage, NASW-NJ.org. And if you scroll to the bottom of that page, you'll see a box that says find a therapist. And when you click on that link, you can go in there and search for therapists based on geographic location, based on areas of specialization. It may even have information about insurance companies in there. And I know that your organization has been working to connect folks with social workers that way.
Yes, thank you. And thank you for the partnerships always. The more we're working together and connecting people, if anyone reaches out for help, we want to get them connected as quickly as we can. And we're always working hard to do that.
Do you have any specific resources, either through these programs or other programs, that could help clinicians who are struggling right now?
So I would say if you are a clinician who is struggling on your own and you need support, please reach out, stop into one of our groups. And even if you want to, keep your camera off, change your name, because you might think there's another participant in the group who could be a potential client, but reach out and get the support you need. Use the text line, use the call line. Also, if you see a need for a support group for clinicians, we'll be happy to host it and put it together. So, we did some of that early on with public health employees. Like I said, we're doing it with school nurses. So we're happy to host and facilitate if you find that there's a need. But individually, please feel free to reach out or jump in on some of our support groups for yourselves. If you're part of an organization and you'd like to invite one of our crisis counselors in to do a 45-minute or an hour on self-care and well-being, we'd be happy to do that. And I know we all know this stuff. However, sometimes it's a nice reminder when someone from the outside comes in and, goes over some of those coping strategies or just creates a safe space to, again, feel validated and to share with some of your colleagues, because maybe it's the first time you're doing that in that type of space. So any help that we can be on that end, we'd love to be part of it.
Fantastic. Yeah, you had mentioned earlier, you were saying, when you're kind of in the midst of the anxiety, when you're in the midst of the stress, it's easy to forget those coping mechanisms. Yeah. They only come to the top of my head when I don't need them. When I'm feeling a crisis moment or a panic moment, I can't remember what to do. So I think I'm going to sign up for the text line.
Oh, good. Yeah.
Get those little reminders and get my song of the day if I need it. Sounds really great.
Wonderful.
Thank you for the offer of establishing a clinician support group if the need presents itself. If a few clinicians reach out to you directly and are interested in that, we'd be happy to work with you to promote it and make sure our folks know about it so that, you can get some robust attendance and, clinicians can have a nice group to support each other. And
thank you. That's wonderful. Yeah, you're all doing the hard work, taking care of everyone else. So we know we have to remind ourselves, to really, provide that care for each one of us also.
Thank you. I have another question for you. Give me 1 second here just so I can.
Okay. And I do see a hand up.
Oh, I missed the hand. Let's go with the hand while I figure out this question. Oh, it's Jean. Hi, Jean.
Hi, I feel badly taking the question again before you read out loud whoever else had a question. But I did want to follow up on that hotline again. I can think of two organizations that I work for in which the individuals are on very limited incomes. So I wondered the percentage of resources and referrals, aside from the free support groups, that are actually free or on a sliding scale. And in particular, I'm thinking of individuals who are looking for counseling services, but just cannot afford currently, the prices out there for a one-to-one counseling. So I did wonder the percentage of resources available, again, aside from support groups, that are free or sliding scale.
And I'm not sure of the percentage, but I do know from talking with our call center staff and our director that they do have clinicians who they are able to refer to for folks that do not have any insurance, or really are looking for that low or very, no or low cost therapy sessions. So they, the first thing they'll do is really work with that person on the phone to find out what their needs are and then work hard to connect them. But I'm not sure of the exact percentages of folks who are being referred to their services.
Okay, thank you.
Sure.
Thanks, Jean. The other question I was looking at before was regarding some service opportunities for other non-English speaking or minority populations. I know you had mentioned that the text line, I think you said, does English, Spanish, and then phone line does other languages as well. I thought you had said there were some groups that were run in Spanish as well. Do you have any groups or programs targeted for folks that speak languages other than English or Spanish?
So the only other group that we have right now is our Haitian American group. And that's through a different program, another wonderful program that we're working on right now for families of color and, other individuals of diverse backgrounds looking for emotional support around COVID-19. So we do offer that group for Haitian Americans. The nice thing about New Jersey Hope and Healing is that we have so many partners, and some of our partners around the state have multilingual crisis counseling and groups. So if you had someone who was looking for a specific language, I could easily, just kind of email our membership, our group list and say, hey, can you support and can you help this individual? So that's the really nice thing about 12 providers is that we have, a real diverse group of crisis counselors around the state who are speaking multiple different languages.
That's great. And from a data geek standpoint for myself, one of the things that you mentioned earlier that I also wanted to follow up on was with regard of collecting identifying information. And I get we're not taking names, we're not taking home addresses or stuff like that, but do you have a way to track demographic characteristics at least? Are you aware ethnicity and racial background people are coming from?
Yeah, absolutely. So although we're not collecting anyone's name, address, phone number, date of birth, we are definitely collecting demographics as far as race, ethnicity. If someone wants to disclose, if they identify as male or female, age brackets, language spoken primarily. If someone is living with and experiences and discloses to us a mental health challenge or a physical or medical challenge, intellectual challenge. So we are definitely collecting demographics in that way for the grant, just not particular to the person identifying information. But yeah, absolutely.
So along those lines, I don't know if you've had a chance to do any analysis of the demographics yet, but I know one of the stories that we keep reading in the news and hearing about is how the pandemic, for instance, has landed disproportionately on communities of color and minority communities. Are your usage patterns reflecting that, or is there a need to get this information out to underserved communities to make sure they have it? Like, do you have any sense of that yet?
I can tell you from looking at the demographics, there is a need to continue to get that usage out to those communities. The Mental Health Association, in addition to New Jersey Hope and Healing, has a new program focused on emotional support for families of color impacted by COVID-19. So we are working really hard to make sure that we are working with those communities. We're doing some work with church leaders in the most impacted counties in the state. When you think about the North, we're working with some church leaders to focus on general mental health education, family support groups for families of color, offering diverse staff as the group facilitators so that we can connect to those who are maybe not accessing health or mental health services. So it is something that, aside from New Jersey Hope and Healing, we're working really hard at the Mental Health Association. But you're absolutely right. We definitely are seeing it in the data reflected.
Thanks. Carrie has a question about clients who may be uneasy about seeking help or who have never reached out for support like this before. Is there a program that's, I guess, an easy in, like, as opposed to one that might be a little more off-putting? Are there, like, for the groups, are there smaller groups if somebody's interested in a group? Are any of the groups closed membership so that it's not just people floating in and out? Like, what about those therapy resistant or therapy unsure folks?
So they are open groups, but what I do like is that sometimes people will call me ahead of time and I can say, like, oh, I know this group's really small. You know, we meet and there's about 5 people who come. Or I can say, you know, this group we meet and there's about 20 people. So I have my pulse on each group, so I can tell you which ones are smaller, which ones are larger. I do find that some of the individuals find, you know, going to the, you know, like, what's next group or now what, that seems very, you know, general, less stigmatizing. It's not. And if you notice, nothing that we do is connected to the words mental health or mental illness. It's all about emotional support and looking at how do we support parents? How do we support school nurses? How do we focus and talk and discuss grief and loss? So we are really working in New Jersey Hope and Healing to reach out to those who may have never tapped into the mental health system. And many of the people that we're meeting, of course, we are serving individuals who were already receiving services, but many of the individuals we're meeting in this program have never sought mental health or emotional health support until now. We're often the first time that someone says, hey, I saw your support group and I am struggling, and it is because of COVID, and here I am. But I definitely would say if someone is feeling angst or worried, to call me and talk it through, and maybe I can guide them to the group that might be a good fit for them. Because we know it's hard. It's hard for any of us to walk in, virtually or not, to a support group for the first time. But then we do find once someone's there, they're like, oh, I'm with a group of people who get it. I'm coming back each week. So, but it's just making that initial way in, and I'll help people with that as best I can.
Wonderful. Any other questions for Jamie? We've got about 8 or 9 minutes left still in the webinar. I have a couple of people who've been watching on Facebook who have just chimed in to thank you for your resources and for the support that you're providing.
Thank you. Thanks for watching today and being here and connecting other people with these resources, hopefully. Yeah.
While we have the time, I guess, at one point you had mentioned a monthly forum. I think it was fourth day programming. I don't remember if you said this before, but what are some of the programs that are lined up for fourth Thursday for the next few months?
So what we have coming up, like I said, this Thursday, we'll be learning more about the VOAD and, other disaster volunteer services. And then in July, we will be talking about reentry stress. So I think that's a hot topic. And we'll be talking about back to school, back to work and back to life, reentry stress. And then in August, we will be talking about back to school. So, that can be for parents, that can be for providers, school staff, all of us who are looking as a community how to ease our way back into school in a way that mitigates some of our stress. So yeah, July will be re-entry into work or life, and then August will be back to school. And then I think in September, we're going to have some of our providers who offer Spanish speaking services to come together and bring in as many providers as we can so that the groups can see, okay, this is what's available in Spanish. So a couple of things coming up that we're excited about in the monthly forum.
Wonderful. Any other questions? Jamie, I think at one point you had mentioned also that you might have some resources. So if you want to email me any links or documents that you might want to share with folks, I can send those out to everybody who's registered for the call today as well.
Oh, wonderful. Okay, that would be great. So I will send you all of our New Jersey Hope and Healing, kind of in one email or e-blast, so people can access the flyers, they can access the online calendar, share that with other people, and then just look at everything else we do at the Mental Health Association in case there's a need for other referrals and linkages.
Yeah, it doesn't seem like we have any other questions pending. Do you want to just use the last few minutes just to kind of touch base on some of the other services that Mental Health Association has?
Yeah, absolutely. So we have a slew of virtual support groups. In addition to the New Jersey Hope and Healing, we probably have another 50 groups a week that we do on so many different topics around mental and emotional wellness. So that's definitely something to check out. And then we have a lot of information around advocacy and education. We have the mental health players, if you're not familiar. They use theater and art. They're doing it virtually right now to focus on reducing stigma and getting the word out there. So if you're interested in booking or attending a performance, please look up the mental health players. That's one program that we have, and they're fantastic. We have a program called Pathways to Recovery, where we are helping individuals impacted by the opiate crisis return to work. And when we say impacted, that could be themselves, the individual, but also could be a family member who is impacted because of their loved one. And because of that is in need of support to return to employment in the workforce. We have, so many groups around wellness and recovery and, substance use working together. So kind of those co-occurring groups. We have our virtual wellness centers that are happening all over the state, like I had mentioned. And the beautiful thing about many of our services at the Mental Health Association is that they're peer run and peer focused. So you are really coming to a group with people who understand and get it, peer specialists who have their own personal experience and the coursework and are providing those services. We have our peer outreach support teams, which you can kind of think of that as, I don't want to say light case management, but really systems navigation. So those staff on the peer outreach support team can work one-to-one with a member, participant, consumer, and help them navigate the system. We know sometimes navigating the mental health system is really tricky and difficult. And it's especially difficult if you're feeling symptoms of anxiety or depression. So being able to have someone, an advocate, a coach, do that with you is really helpful. So that's another program that we have. So I wanted to mention that also. So, kind of think about our players, our wellness centers, our virtual groups, our peer outreach support, and then of course, our pathways to recovery. So, and then, lastly, I know I'm running out of time. We have so many programs, our family programs, our intensive family support services designed to support families who have a loved one experiencing a mental health challenge or substance use disorder. We work very closely with NAMI, and then we have family advocates who again provide that support to the families, which we know is so important for families to understand mental health challenges, to be the best support they can, but also to gain that education. So that's a little bit about what we do.
Great. You guys have a fantastic organization. And I tend to, in my work, I interact more with your advocacy folks, with Barbara on a regular basis. So I don't always see all of the clinical support stuff that you're doing. And it's so wonderful. Jaime, thank you very much for joining us today. We will wrap up in a second. It's just about 12:57. So I thank you all for your time today. And I will just remind you that we are recording today's presentation. And I will email a link to that presentation with the resources that Jaime sends to everybody who registered today. So if you would like to find the archive presentation or rewatch it or share it with folks, you're more than welcome to do that. It's going to be available on the NASW New Jersey YouTube page and on the Facebook page. And as I said, I will send out that link. And thank you all for joining us today. And we'll see you at our next conversation. Bye, everyone.
Thanks so much.